You might be wondering, what should I do to prepare for ketamine therapy and what should I expect? If so, you are watching the right video. In this compilation, I'm going to share everything you need to know before starting ketamine therapy, including what to do and what to expect during your treatments. We will cover essential questions to ask your ketamine clinic, the importance of fasting, and more. Plus, stay till the end to learn how to avoid a bad trip and increase the likelihood of a good experience. If you're considering getting ketamine therapy, you may be wondering, what questions should I ask the ketamine clinic specialist prior to getting ketamine treatment? So if you have that question, you're watching the right video because I want to go over 10 must-ask questions at your ketamine clinic. Number one, will someone be with me the entire time? Ketamine can create a really vulnerable state, and when someone's alone by themselves, it can be frightening and challenging, especially if they feel particularly vulnerable. So it's really important, is someone going to be with me throughout the entire infusion? Number two, how do you determine the dose of ketamine? Typically, ketamine infusions start at roughly 0.5 milligrams per kilogram over a roughly 40-minute infusion. But different clinics may have different protocols. So it's really important to ask, how do you determine the dose? Number three, will I have my vital signs monitored throughout the entire session? This is really important because sometimes ketamine can increase blood pressure, it can drop oxygen levels, it can make the heart rate speed up, slow down. There can be cardiac arrhythmias. So it's important to know, am I going to have my vital signs monitored? We call them vital for a reason. Question number four, how much experience do you have working with ketamine? Some people might be brand new, where they've been doing it only for 3 months. They may not have had residency training with ketamine. So it's important to know the experience of the clinic that will be providing ketamine therapy for you. Number five, you can ask the question, what do you recommend for preparing for the ketamine therapy? Some clinics don't have any preparation guidelines. Others have an extensive protocol and guidelines and recommendations for the patients. I think that preparation piece is crucial because it's almost like if someone is starting a new garden. You really want to prepare the ground prior to planting the seeds, getting rid of old rocks, weeds, putting in some fertilizer. And so this preparation question is really important. Number six, what does your integration plan look like? So ketamine therapy can be amazing, it can be the catalyst, but if someone doesn't necessarily have a plan or protocol to put into place to take action after the ketamine therapy, it may not lead to as much robust beneficial effects. So this integration question and what is offered can be crucial to ask as well. Question number seven, will I have eye shades, a blanket, a music provided for? So at our clinic, we do provide all three of those things with a very special playlist and headphones, Bluetooth noise canceling, eye shades, but other clinics may not offer that. So if they don't, you may personally want to bring in your own playlist, your own eye shades, your own special headphones, so that you can really embrace and maximize the experience. Question number eight, you might ask, why did you decide to open up your clinic? Now, some people may be doing it purely for profit reasons. They just want to make revenue. Other people, they may really have an inherent motivation and a purpose behind why they're opening it up. So it's kind of a personal question to ask, but I think it's important. Sometimes knowing the clinician's intentions can be really useful for you to personally know. Question number 9. Are your staff BLS and ACLS certified? So we know that ketamine can definitely have side effects like any other medication. It's important to have medical personnel with the appropriate training to handle these situations that can potentially come up. And question number 10, can I get a refund if I don't like the experience? Look, ketamine therapy can be amazing, but if you undergo one infusion and you're like, man, I'm just not feeling this, this isn't right for me. Well, you've tried it, and it may be important for you to cancel the remaining infusions. So it's important to ask, well, what happens if on the first one it just doesn't feel right? Will I get a refund, or is my money already deposited and I can't get it back? So kind of asking a logistical question can be really useful for you. I hope this video was useful for you, and now you know 10 questions that you can ask when you're considering going to a new ketamine clinic. I want to share with you a couple of medications that may decrease the effectiveness of ketamine. The two most commonly observed medications that seem to decrease the effectiveness of ketamine are lamotrigine and another category of medications called benzodiazepines. So multiple studies have shown that when someone is taking either of those medicines or even both, it could reduce the effectiveness as well as the duration of the ketamine experience and effectiveness. Now, what's interesting is there's a few other medications that could also interact with ketamine. Those medications are clozapine, haloperidol, and risperidone. So there needs to be more research on the interaction of ketamine with those three medications, but there definitely seems to be some interactions between those. Conversely, we've had patients who are on SSRIs and SNRIs without significant interaction from the ketamine, which means someone can be taking some antidepressants and still get the maximal effect from ketamine. But what's really important is for you to speak with your ketamine specialist so that they can review which medications may or may not be helping you during your ketamine experience. You may be wondering, why do I need to fast before my ketamine infusion therapy? And if you have that question, you are watching the right video. My name is Dr. Ko, and I am the founder and CEO at Reset Ketamine in Palm Springs, California. Today, I want to go over the importance of fasting prior to the ketamine infusion therapy. And the biggest reason is we want to have the stomach empty because there is a potential risk of something called aspiration. And aspiration is where the contents of the stomach start going in the opposite direction through the esophageal sphincter and out, and then becomes inhaled into the lungs. And that can be dangerous because that can lead to pneumonia, infection, choking. And as a result, we want to have the stomach empty roughly 3, 4, 5 hours prior to the ketamine infusion, because if you don't, we don't want to have that risk of food or other contents coming from the stomach and down into the trachea and the lungs. So hope that answers your question, and I will see you at our clinic here at Reset Ketamine. We have 4 phases to ketamine therapy. The first one is preparation. Second is intention. Third is experience. And fourth is integration. As an analogy, I would think about gardening. Before we plant seeds, we want to prepare the ground, which might look like pulling out weeds, getting those big rocks out of the way, checking the pH, maybe putting in a little bit of fertilizer for the garden soil. So that's the preparation. Next is the intention. I think about the intention as a seed that you're going to be planting in the garden of the mind. So whether that's peace, joy, contentment, relaxing, whatever it may be, planting the seed and having a really clear idea of what seed I want to plant. Third is the experience. And I think of the experience as actually doing the work of putting the seed into the ground, right? So during the ketamine therapy, focusing on the intention of planting the seed. Finally, the fourth is integration. And integration looks like making sure that the seed gets plenty of sunlight, making sure that there's plenty of water, making sure that the nutrients are there in the soil to cultivate the seed. I love this metaphor of gardening because it really applies to our mind. Our minds are nature. We are a biological process, and using this gardening metaphor can be really useful as you begin your journey of ketamine infusion therapy. One of the questions that I'm asked about are the preparation that one needs to do before ketamine therapy. And so if you have that question about preparation, then you're watching the right video today. My name is Dr. Sam Ko, and I am the medical director at Reset Ketamine in Palm Springs. And today I want to share with you the importance of preparation. So I think about the ketamine journey almost like starting up a new garden. And before you plant the seeds of the garden, what you want to do is prepare the ground, right? You want to like get all the weeds out, maybe remove some rocks, clear some debris, maybe put in some fertilizer, so that the seed that you're planting would have the best chance of growing and living. So at our clinic, we recommend our patients prepare for 5 days prior to their first infusion.
And that can include such things like meditation, journaling, stopping alcohol, marijuana use, avoiding violent movies or horror shows, kind of taking a break from people who may not support you as much as they can. And again, we want to have kind of that fertile ground. We want to have the most optimal mind space that you can be in, because the intention, which is, in my view, kind of like the seed of the gardening metaphor, so that the seed has the best chance of growing and thriving. So I hope that answers your question about preparation, and I
There's a
will see
really
you
interesting
in the
article
next.
published recently in the Frontiers of Human Neuroscience. And I'll read the title to you. It's a bit long, so bear with me. Imprinting, expanding the extra pharmacological model of psychedelic drug action to incorporate delayed influences of sets and setting. And this was published in July 18th, 2023. Now, what's fascinating about this article is that it showed that if someone had a high level of media exposure before their therapy session, that it actually overpowered the intention setting process. And for those participants who decreased the use of media prior to their sessions, they had a more robust experience. And in particular, they could use that intention tool that I've spoken about previously. So this is one of the important things. Our minds are like our digestive system, right? So whatever you eat, it will eventually become a part of you. Proteins, carbohydrates, glucose, fatty acids, all of that comes from our food and eventually becomes a part of our body. Similarly, I think the things that we consume mentally, whether it's books, whether it's social media, whether it's news, whether it's this video, all of this will play a building block in our psyche. So, before someone undergoes a ketamine therapy at our clinic, we have them prepare mentally. This may look like taking a break from violent movies, from horror movies, from that legal thriller crime show that you may love to watch. Because all of that, and especially a lot of it, might show up during the ketamine therapy. It reminds me of one patient that we had who was watching Grey's Anatomy, like literally the morning before the infusion. And during the session, the patient reported a lot of Grey's Anatomy scenes were coming up, and it was a little bit intense for that person. So be really mindful of what you're consuming, not only via your mouth and the foods we eat, but also mentally. All of these things eventually do become a building block to our How psyche. Do you prevent a bad trip during ketamine infusion therapy? And I've been thinking about this question a lot because bad trips can be challenging, and I want to do my best to prevent that from happening. So one of the things that I suggest for my patients is to know exactly where you are going. And what I mean by this is setting an intention, having it very clear in your mind's eye exactly where you want to go on the journey. There's this old saying, if you know where you're going, you won't have a bad trip. And taking that really to heart and knowing, what is it that I want? What is it that I really, really, really want? If we had a magic stethoscope and we could do anything we wanted, where would you go? What would you do? Who would you be like? And that is where the intention comes in. By knowing exactly where you're going, it will reduce the likelihood of a scary or bad trip. Now, of course, that's not 100% effective, but it can be incredibly useful when you are going through the challenging experiences to know where you're going. I think about a ship. Ship's in the ocean and it doesn't know exactly where that ship wants to go. The captain doesn't know. And so it's thinking, okay, I'm just going to go with the waves and wherever it goes. Now that can be useful, but if that captain of the ship knows exactly where he or she wants to go, then even if they do face those thunderstorms or typhoons or riptides in the ocean, the ship will know where to go. So, thank you so much for watching. I hope this compilation has provided you with valuable insights and practical tips for your ketamine therapy journey. Remember, preparation and understanding what to expect are key to a successful treatment. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you never miss an update. Stay informed, stay prepared, and see you in the next video.